One, and we're live. So, um, this is going to be an interesting stream because, for the most part, a lot of my detractors have been upset that I have no quote medical experience. But I was in a comment section the other day of a previous Ron Paul fan who is now saying fuck Ron Paul because he happens to say that maybe this martial law thing ain't so great. And before I got blocked from that person, I saw that an old Facebook friend of mine had been saying things similar to what I was saying in those comments, and he claimed to have medical experience. So we talked about it for a bit in private messages, and I asked him if he'd be willing to come on and talk from his medical perspective about why this martial law bullshit doesn't work, why this lockdown is probably the wrong reaction, and why a lot of this stuff, from a statist perspective, is the wrong prescription for this illness. So, with all that in mind, before we get into any of this, I'm gonna give the sponsor read. This is brought to you by Liberty Professionals, a private investigator out of Virginia. Liberty Professionals will help you secure your home, small business, and life. It's run by a residential security expert who's an ASIS board-certified physical security professional. If you need work done in the Virginia area, they do missing persons investigations, skip tracing, and more. Contact them for more info. He has all the necessary tools in his toolbox to bring you peace of mind and stability for the future. Support Liberty businesses and these streams by heading over to libertyprofessionals.com to get your consult today. Now, Ryan has 25 years in the study in the biological sciences, including applied zoology, plant competition ecology, and human health, and 3 years of clinical experience as a licensed practicing physician. And he thinks the state ain't the answer. He also has 10 years of teaching allied health, nursing, rad tech, and massage therapy students in various subjects such as general biology, microbiology, including epidemiology, food and water quality, and pathology, and Human Anatomy and Physiology. Is a former contributing blogger to Pan American Post, a libertarian think tank focusing on health in the market, and was a guest on the Stateless Man radio show as an expert on higher education. So, in case that doesn't cover everything, why don't you tell us, what brought you to sort of the liberty side of things, and also anything I might have missed?
Oh, okay. I think you pretty much got everything that's relevant for our discussion here as far as my bona fides. But it was a very long, twisting route for me to get to where I am now. In all essence, basically an agorist slash voluntarist, and my own philosophy of consent and self ownership. So, the last straw for me was the 2012 election, of course. Ron Paul was really hosed. I had new friends that were personally
Mm-hmm.
delegates in the GOP that were kicked out of the delegation during the Louisiana caucuses that year. Ron Paul had won the state. However, the powers that be wanted, who was it, Romney, to take it.
Yeah.
They brought in, yeah, they brought in the state police chief, and he physically removed them from the building in order for the delegates to go to Romney. That was really the last straw for me, and I completely gave up on anything on the state side at that point. I was a minarchist for a number of years, holding on to stuff, and I really couldn't justify anything from that level. And from that point on, I'd gone on to full anarchism. If you want to call it anarcho-capitalism, voluntarism, voluntary lifestyle, whatever. That's where I have been for the past 8 years now.
Yeah. Well, it's very similar to my experience. I started out as a fucking stupid neocon who supported Bush in high school, and then went through like a Gary Johnson phase, a Ron Paul thing, and then Ron Paul getting the shaft at the convention sort of shook my faith a little bit in the religion of statism. And then, after that, I still tried to keep the ghost for a bit, with Young Americans for Liberty activism on a college campus nearby, but eventually realized that that was all trash too, especially given the fact that they supported Rand, who sold out his father during that convention. Like the whole thing with him endorsing Romney, why? But that, including like, you know, watching police brutality and war videos, really sort of pushed me over the edge, because I told myself I wasn't gonna, you know, support this if I couldn't support the whole package. So I forced myself to watch hours of that, and you know, the agreement was that if I didn't still support that, then I couldn't support the state. So I was an anarchist after that point. It took like a year after Ron Paul. But with that in mind, what was your sort of like? Because you're a medical professional. The medical
Mhm.
profession is overwhelmed with statism. So, what
Yeah.
was your experience with sort of becoming an anarchist with that context? How did your friends react, your colleagues?
Well, my transition over from clinical practice into academia occurred a couple of years before my full transition into anarchism. However, I can tell you the least palatable part about being a physician is dealing with all the paperwork and the government restrictions and regulations. They really do restrict the market. And if anybody tells you that it's a free market out there in the United States for medical services and health in general, they are, I hate to use such personal attacks, but they're delusional or ignorant. That's really the only thing that I can think. Anybody that's in the system on the provider side knows this. The lack of competition within the insurance field, the inability to do double fee schedule except for through these large insurance companies for people that may be hurting financially or just wants to pay cash and do a little discount, which saves both on the provider side and on the consumer side, as well as remittances from these insurance companies, including government programs, which can take upwards of 18 months or more to get a fraction of what the service is worth. It was a huge headache, and I had kind of a life-changing event. I nearly died in a motor vehicular accident
Mm.
in December of 2009. I said, I can't handle this anymore. I had my own clinic, plus I worked in a group practice in two different places. I was driving around working 6 days a week. The money just wasn't worth it, Jeremy. And I have to tell you, I was absolutely just relieved. It was like, I don't know, like when you've got a bad tooth pulled or a pimple that needs to get popped, and then all of a sudden it's gone, and it's just like, and I never looked back. I have never regretted that decision whatsoever. This was a year or two, I guess, before Obamacare slash ACA became fully implemented, and I don't know how anybody's dealt with that since then, other than going to a basic cash only practice on a pro rata status.
Yeah, well, and you know, so before we get into any of this, I wanted to ask you, because we're talking about this from that sort of decentralized perspective,
Mhm.
how much does frivolous lawsuiting and, you know, basically malpractice fraud factor into your sort of disdain for the state's involvement in the medical system, or was that a huge factor at all?
Oh, without a doubt, malpractice is and the dangers therein are drilled into us when we're like first year interns. Without a doubt, malpractice is a big deal. There's this perception that doctors have a lot of money and therefore they are unfairly scalping people or con artists or hucksters or whatever, and so they deserve to be sued. Um, the burden for malpractice insurance can be anywhere from $5,000 to $10,000 for somebody who's in more of a general practice, or like I was doing active rehab for traumatic injury, all the way up to $250,000 or more a year for somebody like a neurosurgeon or hand surgeon. The absolute fear of litigation is terrifying to physicians, I can tell you. And the burden on a physician is almost as high as all the other restrictions as far as regulations and all the taxes that you have to go through. as far as owning a private business, as you probably are well know.
Okay, so I mean, how much does that? Okay, so how much does that factor in your decisions? Like when you make a decision as to like care, are you one of the doctors who says I don't want to get sued so they didn't do something?
Oh, no, no. I'm a very not cavalier. I fully express my intent. Like I said, it's been a decade since I was in practice, but I
Right.
fully express my intent to the patient. And because I come from an academic background, I was teaching at the collegiate level all the way going back to 2000, 2001 before I ever became a physician. So informed consent, without a doubt, has always been a big deal to me. So whenever I folded that into my personal beliefs on consent on all levels, it worked out really easily for me, as well as being a mentor or educator towards a patient. And in effect, a patient and a student or a pupil aren't terribly different. You're dealing with an individual that's coming from ignorant and an insult, lack of knowledge, and you are there to kind of guide them. In the end, the student or the patient has to decide to learn and accept whatever advice that you are applying there.
One, of course, and like that would make because you're the doctor, you're the teacher. They're clearly there because you have something they lack. Um,
Yes.
so okay, so in terms of that lacking, um, a lot of the stuff lately surrounding Bugaboo, which is what I'm going to call it because it somehow that hasn't been added to the list of blocked words. Um, with regard to Bugaboo, uh, how much have you seen the docs you still talk to upset about being, for instance, forced to only treat Bugaboo, and not like and have entire sections of hospitals like cardiac units and intensive care units completely devoted to that? How much have you heard that happening, and how many are frustrated with that?
Oh, with many of my colleagues, former colleagues, I guess I should say, the frustration is real. It's there. My association network goes beyond just physicians and goes into stuff like dental, nursing, home health, and the like. And I want to say it's almost universal, other than a few different exceptions to the rule. If somebody is not in ICU, infectious ICU, the amount of work they're having has been drastically reduced or completely eliminated.
Mm,
These are well-trained individuals, and because all focus on funds and monies and the like, and just how to publicity in the public, going to coronavirus infections, COVID-19, whatever you want to call it, um, because of this, they just can't work. I got a friend who's a surgical tech. She hasn't been working for weeks because she does elective surgery only. I've got
mm.
friends that are nurses, and even in the ERs, a lot of them are being furloughed. It's the whole situation's ridiculous. I got friends that are dentists, podiatrists, chiropractors, physical therapists, and they're just not allowed to see patients. And this doesn't make any sense whatsoever. I can understand closing down maybe a wing of a hospital where truly elective stuff is going on. We use the term elective surgery. That means that it is not an ER or ICU situation. You have to understand,
Right, it's
but
not
it
an
could,
urgent situation.
but it could be something like a stent into a coronary blood vessel, or it could be such as a good friend of mine where she can't get a hip replacement now. I mean, this is ridiculous.
Right, because not all elective surgery is cosmetic surgery. A lot of people make that mistake and think that like, oh, it's elective, so you're like getting a nose job, but it's not that simple, and most of that problem is because people think the word elective means that it's totally optional, but a lot of elective surgery is necessary to go back to work, to reintegrate into society, to deal with like the physical aspect of recovery. And like a lot of the stuff that like because I don't have a medical background, I've never went to med school, but I do have a lot of family in medicine, and they tell me some horror stories about people who don't get the proper elective surgeries. Um, and like for instance, a friend of mine, he had severe uh, spondylolisthesis and sciatica, and it was crushing his nerves to the point where he might have been paralyzed from the waist down if he hadn't have gotten his surgery
Hmm.
at some point later in life. And it was searing, unbearable pain every single day before that. Especially in like a car, going over a speed bump was like getting stabbed in the everything. And, but he could still walk, he could still technically do work. He was just in severe agony all the time because of this spinal issue. So he had elective surgery, but it was elective surgery to solve an extreme problem.
Hmm.
And that's something that people don't consider because people aren't versed in this terminology. Um,
Yes. The thing is, with quote unquote elective, there are going to be alternate strategies. Say, in the case of spondylosis or arthritis of the spine, there may be attempts with using oral muscle relaxers, maybe using traction, spinal traction, injection of steroids, whatever. Uh, but in the end, this is more than just a quality of life. This is a quality of being able to be a functioning member of society,
right.
and just putting this stuff off. A lot of these things are degenerative in nature because let's face this, we're not, for the most part, we don't deal with infectious disease on a gross scale anymore in the 21st century, at least in the United States and other developed nations. Most of it is dealing with chronic disease and disorders. And
Right.
so what we have now is we have this whole paradigm where we're focusing all of our money's intentions on an infectious disease that the numbers don't play out on this at all. I guess we can get into that in a little bit. I don't want to jump the gun too much. But these chronic disorders where people just dramatically need this work can't get it done
Mm-hmm.
because they're being stopped from getting these surgeries or having these treatments or getting the medications they need or being able to even see a physician other than maybe through a Skype call like this.
Yeah, right. Well, and that's because one of the frustrations I've seen pretty regularly is that we need to have a swab like practically lobotomizing us deep into our fucking skull if they want to test for COVID, but somehow we can do that over a Skype call. I mean, I get that like a decent chunk of these Skype calls are done to determine whether or not the symptoms are not COVID, and I can see that being somewhat effective to reduce workload. But if all these hospitals are running empty, with all these bored doctors sitting around not testing anyone, not treating anyone, not doing their normal jobs, so it's spiking a bunch of other curves, to me, the idea of just treating by Skype call is not only atrocious and absurd, but ridiculous because we're dealing with like a disease that requires like to be skull fucked with a swab. And then like if you don't get that, you can't get the proper sample, but somehow a doc over the internet is going to be able to tell you that. What? I'll just consult WebMD. It's faster and it's free, and why am I talking to you, you know?
If somebody isn't regularly dealing with pathology, and this is a misconception a lot of people have. Yes, when you do rotations and you take your academic and clinical courses uh, to qualify as a physician, and when you go through all of your board examinations, you are going to have to know everything. Okay, that's just stuff that you have to get through, so to say. It's run the gauntlet. However, when you are in practice, unless you are an epidemiologist or a pathologist or somebody working in an ER where you're going to often see these things, or an intensive care unit that deals with infection, the reality is you work on your specialty and that's it.
Mm-hmm.
You have to go and refer to stuff. Now, the good thing is as a physician, you are trained in order to find quality of source material, and you are taking your time out for that, and patient is paying for your expert advice, so to say. And I don't think a Skype call necessarily as a screening tool is bad. However, um, designating treatment based upon that is, I don't know, uh, almost to the point of below standard of care, I would say. Now, history will be 80% or more of your diagnosis, but you can't do any diagnostic tests like this over the phone, at least, or through video conference. You can send in the test to the patient, but how many days is that going to take to get through the mail? You could have somebody pick up, excuse me, the test for the patient and then bring it back and forth. Uh, but the reality, the patient may not be able to take the sample correctly. Your margin of error is going to skyrocket. The science is not going to be good here. And let's face it, Jeremy, a lot of these tests are so-so at best. The Chinese tests that were brought in, kind of gifted to a lot of European nations, were found to have anywhere from 40 to 80% error rate on them. So the trustworthiness of some of these tests is highly in question.
Well, right, and like this virus is bad enough that literal fucking like water brains are telling everybody to wash their vegetables and fruit with soap and water because they're incredibly stupid and don't know that these vegetables and fruit are permeable and that soapy water will soak in, and they also wear a helmet to sleep. But all that all that all that aside, like these sorts of people are worried about a virus that has been said to have that level of contact, like that level of staying power on whatever surface it is. And we're supposed to believe that these testing kits coming from what was allegedly the epicenter, the hotbed of this entire pandemic, is going to be like not infected somehow. None of these surfaces were infected. The test production center had no pathogens in it whatsoever. How
Well,
do we know that these
this
testing kits weren't
yeah,
compromised to begin with?
the CDC has just come out this past week and admitted that almost all the tests that they recently went through were all contaminated. So those numbers have to be tossed. Anything coming out of China right now or any other communist regime, I'm going to go ahead and throw Russia in there. I know technically they're not communists anymore, but I don't trust any of the numbers coming out of these countries. A place like North Korea, they just shoot you dead. There's no testing. Oh, we had one person this week with coronavirus. Why? Because they shot them before they died. The Chinese have been lying about their numbers.
Yeah, well, and like they were lying
Yeah,
about their numbers from square one.
from
Like,
square one, without a doubt. And I mean, it's almost akin to a biological economic warfare they're pushing. They stopped intra-provincial movement from Wuhan, but still allowed overseas flights. What kind of garbage is this?
well, right, and the thing, like, from the start, I was talking about them fudging the numbers in China,
Mm-hmm.
and I was basically like constantly reading all the alternative journalism reports that were essentially aggregating the stuff from mainstream sources that would also make the case against the mainstream narrative. And one of the things that was making the case was multiple funeral homes in China, especially near Wuhan, were said to have been getting in, 2 to 4 times the volume of bodies that the Chinese government was saying were coming in, and were being told to immediately sanitize and then burn them for mass burial. So they were getting so many bodies in that they had to sanitize and burn them all, to the point where they were literally not getting sleep. Like their staff was getting maybe 3 hours of sleep on a good night, and
Mm-hmm.
sometimes not that at all. Sometimes they'd be up for days on end, just clean the body, throw it in the incinerator. Clean the body, throw it in the incinerator at such high volumes that the bodies were piling up. And like, if that's not the sign of an evil regime we maybe shouldn't fucking trust, when they say that, hey, we've got the problem all sorted out, uh, I don't know what exactly is.
Yeah, well, I read similar reports to you, Jeremy, and I have to say, literally everything coming out of China right now, I do not accept. There is no possible way in this reality we live in that the numbers in China are drastically lower than in the United States. The quality of healthcare, the standard of infrastructure, and just the fact that it was the epicenter of the original outbreak of this Wuhan virus, if you will, doesn't make it doesn't make any sense from the epidemiology at all. They're lying. I don't know how else anybody can take this. And if you're accepting anything from China, man, oh man, I've got a beach to sell you out in Colorado.
Well, right, and you know this fucking it's so frustrating because, like, even within libertarians and anarchists, there are groups of people parroting whatever mainstream garbage pops out. And, like, here's an example. Um, when I started to talk about this months ago, I was calling into question all fucking governments, including the
Mm-hmm.
U.S. government. I was calling out their fucking butt buddies in the WHO. I was calling out all of these people, and in doing so, pissing off a bunch of people. And one of the responses I regularly got was, well, but Saudi Arabia is doing this. Well, but Iran is doing this. Well, but China is doing this. And I'm like, okay, so we don't trust the common person. We don't even really trust the US government, but we should definitely trust the governments of repressive regimes in Saudi Arabia, Iran, China, all these places that are notoriously very tyrannical and very overborne in their responses to things because they can be, since their citizens have no enumerated rights, and since the times when citizens do have some sort of rights tribunal, it's always through the lens of some sort of like nationalist dogma or religion or something like that. And we're supposed to believe those guys but doubt the US, and we're supposed to believe those guys but doubt anybody who goes against them. Exactly when did we give up on freedom, and when did we give up on like vetting information that comes from these people? What happened to trust but verify?
I don't know. There's been an intrusion, especially in the past 10 to 20 years, of Frankfurt School Marxists into the mainstream. Call them Alinskyite or whatever you want. And their major goal is the absolute destruction of Western civilization, the apex of which currently is the United States. All jokes aside, America, blah, 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 blah. We just got to accept it for what it is, based upon military, economic power, Nobel prizes, whatever you want to call it. So their plan is to move towards a more collective, what I call Orientalist type of despotism. And so what they want to see is an absolute collapse of the free market, or anything that's really left of it at this point, and a destruction of Western civilization in general, because they see it as the great evil of the world. As a result, the United States must be attacked repeatedly and all the time, and any of its opponents have to be uplifted and upraised. People have bought onto this paradigm, and it's really sad. You know, people used to joke with us. I don't know, Jeremy. Like I said, I don't know how long you've been in this game, but it used to be the move to Somalia thing.
Oh yeah.
By all means, move to North Korea, move to Cuba, move to Venezuela. I know people working along the border there, or infiltrating in, or people stuck in there getting stuff out. They're eating their pets, man. It's really gross.
Yeah, actually, if y'all in the chat want to go to this URL, I'll put in there, teespring.com/Somalian. I actually have a shirt that multiple people have bought that says honorary Somalian on it in honor of that particular joke. Of
That's
course,
awesome.
of course, that link apparently didn't work, so I'll put an HTTP in front of that so that people can click that. There you go. Um, but I have a bunch of these stupid edgy shirts. I have proud to be on a watch list. I have road hater, a
Love it.
proud conspiracy theorist, a bunch of stuff. Um, so if y'all want to check that out and get something out of supporting me, feel free. There's also PayPal, etc., Patreon. Y'all keep me afloat. Um, anyway, with all that in mind, I wanted to ask you a few things specifically
Mhm.
related, because you teach epidemiology, among many other
Yes,
things.
yes.
I wanted to ask you, first off, what your view is on this lockdown and whether or not it's necessary.
Oh man, this is my major point of advocacy and what I've been dealing with. I want to say about a month now. It's going towards 6 weeks. So I was skeptical at first because I'm always skeptical about blanket type of moves like
Mm-hmm.
this. Really, lockdowns or quote unquote quarantines, that word itself has been relabeled. A quarantine is where you put sick people and lock them up, not the well. So that word should be just completely thrown out. I'm glad that you did use the term lockdown. This is a general lockdown with the assumption that everyone is a carrier. Now, just from a logical standpoint, it makes no sense. Secondly, and I had been waiting to get some data on this, and I finally have the last couple of weeks. There are some regions across the world which never went into general lockdown. Now, this does not mean that they did not use any sort of prophylactic, okay? It just means that the economy in general was not locked down. This is maybe a half dozen places on Earth, Jeremy, and it's really sad. It's so few held on. Of
Right,
course, our
like
gold.
Sweden.
Yes, I was about to say our gold standard here is Sweden, which a lot of people will call an outlier due to its small population, its homogeneity, and the like. Okay, that's fine. So let's compare Sweden to the region of Scandinavia. Their numbers, although maybe slightly higher, are not outside of significant difference, and therefore we can't accept that lockdowns have worked. Moving on from that, we can use other examples. I finally got some numbers in from Nicaragua yesterday. Once again, totalitarian regime, but even informants getting out say literally like 200 hospitalizations. That's it. Now it's a small country, so the numbers are going to be small. The Japanese, however, they have a population like half the size of the U.S., closing in on, I don't know, maybe 150, 200 million people. They have no significant difference. And
Well, right. James Corbett did a
Brazil, et
great
cetera, et
series of videos on
cetera.
that since he lives there.
Yeah, yeah. And I don't like to rely on anecdote. And yes, the testing and stuff like that is suspect. But what we can see in each and every of these instances, each and every of these scenarios, comparing, say, partial or bad data to other partial or bad data, we can still see with a little bit of good there or the wiggle room that we have in there that there's a pattern here, and that the pattern is exactly the same in lockdown regions versus not lockdown regions. Exactly the same.
Yeah, and it's really fucking funny because everybody's like relying on the WHO, who like multiple months ago said that it couldn't be transmitted human to human or animal to human, and then like a month ago, 2 months ago, sorry, started saying we should social distance 6 feet, and then about a month ago started saying that maybe this thing can travel 24 feet. Fuck yourself, you know?
24 feet. They can last on surfaces. These are isolated experiments at best, often barely above anecdotal. They put together these CGI images. A lot of the stuff has not been replicated. It flies in the face of how particulates move via droplet spread. Now they're saying it's aerosolized. I'm not. I'm very suspect of that. Aerosolization would mean that the infection rate would have spiked without a doubt. None of the numbers support what they say. And I did a little background check on the WHO. The head of the WHO was found to be suppressing data on pandemics in general. Bill Gates, I hate to get conspiratorial, but he's one of the major donors to keep the WHO afloat. And he's pushing vaccines, which may or may not have any efficacy. I've dug on that a little bit. Once again, I don't like getting too conspiratorial, but we have to talk about this just because the stakes are so high. He's been kicked out of India because of the number of side effects that he's given to Indian children with
Yeah,
the
like
polio vaccine.
vaccine related injury lawsuits, a
I
lot of
I
them.
hate I hate to use that term because any kind of medication, including a vaccine, has a chance for side effect. Okay.
Mm-hmm.
So there are a lot of good vaccines out there that don't do much of anything to almost anybody. But the
Right.
stuff that he was offering out in India, it was a high tens and hundreds of thousands of people involved, you know? Um,
For profit, by the way.
yeah, for profit.
And like that's the
Um,
thing. I got called a bully the other day because I picked on this poor innocent man, Bill Gates. And I promise that's the word they fucking use. Some people are so servile that they think I'm picking on an innocent man doing nothing but good when I talk about Bill Gates. But they also said that he's giving away everything he has and therefore in alignment with Christ. Um, and
what?
like, yes, I promise. I swear to fucking God here. So there's that element of it, and then like he blocks me not too long later because I'm like completely poning him in this regard, showing him that Bill Gates has not been giving up everything, but in fact been gaining money. He's gained like $500 million over the past half year. It's it's insane, and like he's like a mini billionaire. But like so it's not hard for him to do that.
Yeah.
Or it might be a million. I'm not sure. It's something. I'll look that up before I like
The
open my
last I
mouth again.
saw
But
him with his Microsoft share stock options, he was in the, I don't know, 25 to $50 billion range, but I haven't looked at those numbers in forever. And really, we're just talking monopoly money at this point. But the WHO, on top of having those stigmas over them, are also heavily funded by China. I have, and it's rare that I agree with the president, but golly, I've been having to eat some crow here and agree with him on some stuff. And one of the things was defunding the WHO. I
mm-hmm.
think, frankly, the UN should be kicked out of the United States because it's a joke. And the WHO just shows how big of a joke it is. They're using whatever their handlers, the people that are funding them. And this is one of the biggest problems in science that we're dealing with nowadays. Funding to have hypotheses fit with whatever data, such as with the University of Leeds study a number of years ago dealing with, well, back then they called it global warming. And it just goes on and on. Like I said, I don't want to get too conspiratorial, but that's the reality here. We're dealing with unreliable sources that are putting out trash propaganda that people are eating whole cloth because they have in the past been able to trust these sources. Well, they're no longer trustworthy because they've been completely infiltrated.
Yeah, well, and that's the thing. Like, first off, just to get back to that, Bill Gates is worth $102 billion as of
Oh,
now.
wow.
So yeah.
Inflation.
Well, so I'm because that's the thing. Last year, okay, so he dipped. Like he took spikes for 2 years, this direction to the camera, but and then he dipped a little bit last year, and now he's above where he was the year before, and people are claiming he's giving up all his money. But that's not how this works. That's not how any of this works. How it works is he's putting money in his own foundations. He's filtering money from other people's foundations into his foundations in basically what amounts to corporate money laundering to avoid taxation. Which, whatever, taxation is theft, but he supports taxation, including carbon taxes, so fuck that bitch. But, like, we're talking about people who directly benefit from the things that they're pushing, and in this case, we're Bill Gates, the Gates Foundation, chucked a huge amount of money at vaccine research and a tattoo that would mark people who've had it, which means that people who've had the vaccine, and it's being pushed as for children only, but it's going to be expanded. Everything's always expanded. The state never contracts. So he's got this tattoo he's going to put on children who've had the vaccine for COVID, and it was already in the works like 7 months ago.
Now, wait a minute. Wait a minute. I don't want to cut you off too much, but the children are in some of the lowest risk groups for
Yes.
seriousness of this infection. Why would anybody be pushing for vaccination of children. This makes no sense whatsoever.
Because you've got to get them inducted into the program at an
Ah.
early age. Like Carlin, as the Pope said in Dogma, hook them while they're young. Um, so we're talking. So that's the or not Pope, Cardinal Bishop, fucking Pope.
Yeah, whatever it
Carlin as the
was.
Pope would have been funny, but rest in peace. Um, anyway, like that would have been a funny Dogma 2, by the way, a sequel to Dogma. It would have been a funny Dogma 2 if somehow he was fine after all that and he got to be Pope. That'd be
Yeah.
hilarious. You know, fucking,
Yeah,
how are
like
you still alive? God works in mysterious ways. Um, I don't know. Fucking the the idea. So the idea is that you give the kid this IR tattoo, and if they
Mhm,
reflect the light, the IR light, then they've been vaccinated. But
mhm.
like that's a program that would carry over to adulthood, almost guaranteed. So basically, there's this channel I watch a lot called True Stream Media, and they recently put out a video about how this is all much like a cult induction,
Mhm.
and part of cult inductions is killing the old self so the self can be born anew. Um,
Yeah. Yeah,
and
wiping of the ego. Yeah.
yeah, so because of that, cults often recruit children more than adults because they're
Mhm,
more neurally plastic,
mhm.
and they often also have children born into the cult, so they never learn anything else,
Yeah.
and that's what a lot of this seems like. I mean, the children have already been being born into the cult of statism, and it's really really hard to deprogram from that. As evidenced by the fact that it took both of us years to do it, and we're not
Yeah.
stupid people.
Yeah.
Um, and this new tattoo system might very well be yet more of this induction, because any kid who doesn't reflect the light will then be considered a threat to the other children, and peer pressure is a bitch.
Oh, sure. Yeah, but beyond that, they may be limited from access to different services. We could see. This is why I'm anti-mandatory just about anything. Does a good vaccine work? Yes. Does herd immunity exist? Yes, it does. But making stuff mandatory just it just sours in my stomach immediately. We're dealing with people now, and I'm gonna switch the paradigm just a little bit that you're talking about. So anybody that is anti-protester or pro-lockdown, what I like to call them is contagion cultists or privileged state ovationists. These folks are insisting that protesters are people that go about their business like you or I. Insist on filling out a release form that says they
Mm-hmm.
will not
Yeah.
not be able to or refuse care because they are not acting in a responsible manner, which is utter bullshit.
Yeah, there was a fucking an actual senator, I think it was, no, a representative for his state, and he was saying something very similar to "give up your rights." You have to give up your rights
Well,
if you want to
it's
protest.
yeah, it's this kind of Schrodinger's leftist rights ability, or whatever you want to call it. Healthcare is a right. Okay, great. Healthcare is a right. So you're going to enslave healthcare workers to work for you. But healthcare isn't a right if you decide to go against anything that I am for. So what is it? Is it a right or is it not a right? And this is where we get into problems with entitlements. Healthcare is an entitlement. It is not a right unless you contractually form a positive right as a consumer with a healthcare service provider.
Yeah. Well, okay. So I found the tweet. Um,
Mhm.
you brace yourself. To all who think their liberties are being infringed and want to ignore the advice of medical experts, go ahead and roll the dice. But first, you have to renounce your right to private and public insurance, since we all pay for the socialized costs of your reckless behavior. That's Senator Duff.
Yeah, whatever. First of all, it's built upon the assumption of the seriousness of the virus, which all research is showing that is not really there. You might
Models have
have,
expired.
yeah. Well, the one major model they were touting was Italy. The Italian model was reliant upon an elderly population with a very poor healthcare infrastructure. These things did not pan out, and as a result, we're just not seeing the numbers. Now, people will throw up raw numbers, and yes, 30, 40, 50,000 people dead sucks. It's a bad thing. It's not a good thing. But the reality of the situation is in the grand scheme of things, it is no more serious than any other serious infectious upper and lower respiratory disease. And it's within normal cycles of things, assuming that we can take all those numbers into account. New York City and other places are writing down on death certificates COVID-19 based upon suspicion only, without any testing, and I find that disingenuous at best. So what we're looking at here is a paradigm built upon a lie, in essence. It's built upon a lie. The number of infected, we don't know. It's probably much higher than we thought, mostly asymptomatic or mild. Somebody thought they had a cold over the past winter and early spring. The numbers that are going in, people that do get screened, 98% of them go home. The other 2% that get seen, 80+% survive. Now, some of them may have sequelae like pulmonary fibrosis due to ventilation and the like, but very, very few are actually dying from this disease. And for this representative to say what they said is disingenuous, and really, it's. And man, I don't really know how to frame it, Jeremy. It's just it's very frustrating because we know that the Leviathan has this matrix of control and fear that it works through, and it always grows until it dies. So they're manipulating people. It's like a giant con scheme. It's like the greatest confidence game of all time. Seriously, I don't say that with hyperbole.
Right. Well, and the like ultimate best part is that they've fully publicly admitted that they're coaching doctors to list this as the primary cause of death on the
Mm-hmm.
forms, and they have these public documents released where they literally tell people for the I think it's called the virology surveillance and reporting
Mm-hmm.
statistics, that they need
Yeah.
to report this as the primary cause of death if they had it at all. And that, combined with a disingenuous and dishonest fear-mongering media cycle, creates situations where, for instance, a man who had criticisms of the state and their involvement in COVID treatment. He was a long-time battler with cancer, and he was 60 fucking years old. And he was a 60 fucking year old person who had been a long-time cancer battler, and he died after being diagnosed with COVID, and everybody acted as though he died from the COVID, despite no medical reports having been released that indicate that, and no doctors having said that's indeed what happened.
Mm-hmm.
And everybody ran with the idea that he's a cautionary tale of a person to be used as a way, as an object lesson of like why not to be cavalier about this virus and why to accept the lockdown. And he was a 60-year-old cancer battler. Um, I wonder if you've heard of a lot of doctors who've been reporting that, like, you don't have to mention any names, of course, but
Mm-hmm.
any doctors who've been reporting that they or their colleagues have been biasing the statistics in this way.
Well, there's a lot of pressure on physicians and other primary care providers that do set up diagnoses, as well as coroners and in hospital administration in general, in order to provide this diagnosis. A lot of it is going to be a carrot and stick. And what I mean by that is reimbursements from the federal government are in the
Mm-hmm.
tens of thousands for each and every diagnosis and for each and every death. So we have a false economy here, Jeremy, and it's all predicated upon dealing with this certain ICD, which is the Diagnostic Manual Code. They had to make up a whole new ICD number for
Yeah.
it, and that number is being pushed all over the place. It really is, because most of the hospital has to be closed, keeping these hospitals afloat. So in effect, it's almost a type of blackmail, if you will, or extortion, I guess, in reverse, whereby they are keeping these hospitals afloat that only have these patients, but also, if they don't, then they're going to have to fold up. A lot of rural hospitals are now folding up completely.
Mm-hmm.
They may never be back because they just don't have the patients. They
A lot of
literally,
rural everything too.
well, really, well, I mean, it's part of the agenda to push people into the cities because they're easier to control. But that's a discussion for another time. So we have this, and on top of this, anytime that somebody's anti-lockdown and dies, uh, they and I'll even give it to them if they do die of this contagion. It's kind of waved about there and trumped out there as well. You see what you should not have done. This is a bad thing. And what we have to remember is that the essence of science, epidemiology, healthcare, and the like, is that we can't rely on anecdotes, these personal stories,
Right.
in order to drive the narrative. And that's exactly what's happened on their side. All they have is anecdotes or lies from the Chinese government and WHO. It's just I don't understand it. I just really don't understand it.
Well, a lot of people think they're scientists now. There are a lot of real like pop up fucking like street corner psychics that are coming around like with their crystal balls trying to diagnose you remotely. And these people aren't new either. I've had for a long time people trying to remote diagnose me with a series of mental health issues.
Mhm.
And these people have existed. It's something they call concern trolling, where
Oh yes, I'm very familiar with concern trolling.
yeah,
Yeah.
where and for the audience who doesn't know,
Excuse me.
concern trolling is where you act concerned as a way to fuck with somebody,
Hmm.
and or you act concerned as a way to feign superiority or to circumvent the need to provide proof for things. Like instead of saying why your conspiracy theorist theory is wrong, they'll just fucking say, who hurt you, baby, or something similar to that. Um, you know there's a long series of examples I could make in this regard, but these people have now moved on from caring about like people like me and our undiagnosed mental health issues, um, and they're now doing the same thing with this virus because the more of this info comes out, the more of these TV doctors come out and parrot bullshit. The more of these for-profit institutions belt out these fucking PSAs and all this material and all these like product recommendations, the more people act like the power's in their hands, and the more they act like they're experts, they're subject matter experts now because they listen to a decent chunk of people. But they're not. They never were. Like that's why when they try to remote diagnose me with autism, despite having none of the symptoms of autism, and despite never having been diagnosed that by a shrink, who I have been to, they diagnosed me bipolar and ADHD, not anything related to that. And not, all these other things that they want to claim I am, like, fucking schizoaffective, borderline, all these other things. Docs know what they're talking about to a greater degree than some dude on Twitter, but these people act like they have expertise because they've been parroting mainstream media talking points. So, how would you recommend these people get more direct sources of medical information from medical experts? Because WebMD is fucked. That's how you get Munchausen's.
It really is a conundrum, a really difficult thing here. Um, Man, I wish there was an easy answer to this, Jeremy, to tell you the truth, but there isn't. What you have to always be aware of is look at the source material and look at the tone of the individual that's bringing it out. It doesn't matter if it's a layperson or if it is a credentialed professional. If this professional comes out or this layperson comes out and starts to play the morality game with you, you're wrong, you're bad, you're an evil person or something. That's one of the first red flags. The next red flag would be is, Are they just spouting off the top of their head, or do they have citable material with good analyses
Hmm.
from reliable sources? And this is the big problem we're having of late, especially is the second one. Using unreliable sources, as you noted earlier with the Chinese, and as I noted with the WHO, it's just not going to wing it. It's just not gonna hack it at all. I've been really privileged to be able to be in the healthcare community, still networked, even though I'm not actively in the vocation anymore. And I have found both good and bad out there. And with the good professionals, they have a lot of citation, heavy citation from multiple different sources that are good academic and clinical sources that you can go and, I hate to sound like one of these people, you can go verify yourself. I'm not, of any kind of conspiracy theorist type of person where, well, go watch a YouTube or go Google it. I wouldn't say that at all. But you can definitely tell when an expert in their field is willing to take critique and is going to be verifiable, because that's the only way you can go about this. You've got to be able to verify this stuff for yourself. A lot of people are going to be lazy, let's admit it, but at least if that documentation is around, there is some way to backtrack where the information is coming from, because we can really have, as experts, a kind of tunnel vision, because there's an ego built into that. And the higher your credentialing, the more your ego gets tied into it. I know, because it's something I struggle with often. I try not to get inflamed, but I really do when a layperson tries to question me in a very ignorant fashion. So there's a balance there between making an appeal to authority and a genetic fallacy about the individual that's bringing it about. And we kind of walk the middle ground there, whereby trust but verify, as you said earlier. I think that's a really good phrase here, because in science things are changing regularly. I know I made a few mistakes as far as my projections and analyses early on with treatment, but as far as projections on the epidemiology, I've been very solid. Anybody that's a follower on my social media accounts knows that they can backtrack on the information that I've gone through and analyzed. And it's frustrating to me when they don't on that end. On their end, they need to be able to have a source that's reliable. And that's all there is to it. There's no shortcuts here.
Right. And first off, maybe go with a doctor whose primary social media activity is like talking about medicine, rather than one of these doctors who somehow has this overwhelming caseload but has time to dance in the ER or something. Like I can't tell you how many doctor videos I've seen where they're just dancing around or doing something stupid. And like there was this one that really sticks out in my mind where these docs were obviously not social distancing because there was a cluster of 7 of them piloting a hospital bed like a boat down a hallway, and acting like all dramatic and shit, because that's what they have time to do, and because clearly social distancing doesn't mean shit in a hospital. What? So,
Yeah, I
like,
feel the same way about cops right now.
yeah, it is the same mentality. We're the experts. I watched a video of an interaction in an IRS office not too long ago, where an IRS worker who was authorized to carry a firearm to prevent theft and sort of
Harassment.
hostage situations,
Yeah. Okay.
to keep the office safe. And taxation is theft. I'm not on the IRS employee's side, in that regard, but the cop that came in had a weapon on him, and there's a sign at the door that says you can't bring a weapon in. It's a law, unless you're
Mhm.
an like there are some exceptions, and one of those exceptions is if you're an officer on official duties. Um,
Mhm.
this officer was not on official duties, because this officer was trying to settle a dispute while on hours, while on the taxpayer dole, trying to settle a dispute with the tax office, that he could have and should have settled off hours, and he was trying to settle it while bringing his full belt into the office.
That seems
Um,
like intimidation to me.
Yeah, the guy was very clearly intimidated too. But basically, this guy, the guy working at IRS, he pulled his gun because this guy would not stop advancing toward the second entry. Um,
Holy crap. That's really scary, man.
yeah, and because he pulled his gun on a cop, he's now fired because he did what was legally within his right. Um, to an officer of the law who was behaving illegally. That officer is now claiming trauma and is now collecting a paycheck of like 60,000 because he fucking got a gun pulled on him. But he also pulled a gun on this guy for pulling a gun on him. So he pulled a gun that he shouldn't have had in the building to begin with on on unofficial business when he could have been serving the public. um, and he did so to settle a personal dispute with the IRS that he should have dealt with in off hours and wouldn't have been able to carry a weapon in any way for that
Yeah.
purpose.
Yeah.
And
Yeah. So
because he
yeah,
was
we're
uninformed of the law, he just decided he was going to do it anyway. That's what a lot of these experts do. They think it's okay when we do it. No, it's fucking not.
it makes you hypocritical. You see these politicians, none of them are enforcing this quote unquote social distancing between each other. Very few are using what's called PPEs, which are basically prophylactic gear, such as masks or gloves or eyewear or whatever.
Oh, just for the audience, prophylaxis is preventative medicine. Go
I'm
ahead.
sorry. I get into
Oh,
lingo
it's
sometimes. I
all right.
apologize.
I use jargon way too much anyway, so
Mhm.
it's totally
Yeah.
fine.
I forget sometimes because it's terminology we have to use whether or not we're in the clinic or if I'm in one of my bio labs with students. Anyway, so it's stuff to prevent a spread of disease. Uh, our local mayor was seen like wiping her face with the mask recently. I mean, Jesus, on camera. Well, she's known to be a clown, and every single one of her responses of late has been absolutely ridiculous. But the point is, well, there you can't expect people to follow your edicts if you're not willing to also do it. They're doing COVID checks around here. The cops are every single day, and all it is a seatbelt and license and registration and insurance check to hit you with to hit you with fines because they're making literally next to no money in taxes. There's nothing for these governmental entities below the federal level to get money from. So
Right.
they're just sitting here taxing people. They're just taxing people and they're fining people because they have no ways to do it. They are literally road bandits right now. And I see reports from my friends online every single day. Check off at First and Main. Check off at, I'm just using random street names here,
Yeah, yeah, yeah.
Wainwright and Bundy or whatever. And it's literally every single day.
Right. Well, and that's one of the things. Like the governor of fucking New Jersey says we didn't think about the Bill of Rights when we did that, and he was referencing to arresting peaceful churchgoers practicing social distancing in their fucking cars.
They don't
Um,
care,
yeah,
you know.
and
Most of the demonstrations are going on are people in their cars.
yeah, and like, so I posted this thing March 18th, so almost exactly a month ago. I
Mhm.
said, "You're not being lied to. It's just that officials keep touching their faces, shaking each other's hands, amassing in large groups. Even those who have confirmed cases of COVID, if they catch you doing it, you're arrested or locked down. Some animals are more equal." And I also posted this thing about a paddleboarder who got arrested in the middle of the fucking beach in Southern California.
I saw that. That was ridiculous. They send all that manpower out, and the cops are there, no gloves, no mask or anything, and dragging him off. He's literally by himself. You could not social distance any greater than that.
Right, and so I posted, "Hey, you there, in the middle of the ocean, far away from anyone else, not touching or coughing on anyone. You're under arrest for the sinister crime of doing something we don't like. Surrender at
Hmm.
once. Don't ask why it's okay for us to be here, though."
Hmm.
And
Hmm.
like that's how it is. It's been that way every single fucking day. And like
Most
what
public parks are closed right now, Jeremy. It doesn't make any sense. You're concentrating people into groceries and pharmacies and big box stores. And then they're going to say, well, look, there's spikes due to all these people packed in here. Well, if you close every place down and there's no place else for people to go, what the hell do you think they're going to do?
Well, right. And that's the thing. Like, people don't care about civil rights abuses right now. I mean, need I remind anyone that his name was Duncan Lemp? Need I remind anyone that her name was Breonna Taylor? Like, there are cases that happen every single day where somebody is being abused, but nobody cares because cough, you know? And nobody
Yeah.
cares about the abuses that are coming down the pike because of cough. Like, you want to talk Bill Gates? I wrote an entire fucking article that most people ignore, and some people who claim to have read it also ignore because they don't have any arguments, but they still disagree. Where I go over how Bill Gates has been pushing tattoos for vaccines and vaccines in general, how how there's an ID 2020 system, which will be using facial recognition, very contact-free facial recognition, might I add, to monitor us all with permanent blockchain IDs, and all while the U.S. government is pushing a new digital dollar because, hey, if you're going to collapse the economy, you might as well collapse it in style while being able to print whatever you want with no physical reserve requirement. And so the Federal Reserve is working with a company called Accenture. Accenture is
Mm.
working on the same board as ID 2020, and this is working with Microsoft and has been since before Bill Gates got off the board. And all this stuff is just, it's insane to me that people don't see what's coming because it's all written out there. It's all public already. And they don't care about their liberty abuses. They don't care that they're wandering into a facial recognition superstate dystopia. It doesn't fucking matter to them. And when people like me bring it up, I'm not a subject matter expert, so they dismiss me. But you are a subject matter expert, and you also think that this is an absurd overreaction and likely just a power grab. Is that
The,
right?
the, the numbers just don't add up, Jeremy. Everything that I've looked at. Yes, the people that get it and get it severely, they die. They die a horrible, terrible death. They die of pneumonia. If you can imagine fluid filling your lungs slowly, that's what they die of. It stinks. They're getting blood clots throughout their bodies called DIC, or disseminated intervascular coagulation. They have to be put upon blood thinners and the like. These things do happen, but they're so minute. And the people reporting them on them that are working anecdotally within these ICUs, they're like, man, it really sucks and we're working a lot. Yes, you are. And yes, it does suck. But then in the grand scheme of things, the numbers just don't add up. I mean, we're looking at basically, and I know it's not the same disease. And I know, the pathways and everything are a little bit different. But, you're looking at numbers on par with a typical body count. And I hate to be so grotesque, but it's the reality here.
Yeah, you're
Body
on this
count of
channel. I'm a pessimistic, dark asshole. I'm always talking about rivers of blood and years of darkness, so this is the perfect channel for talking that way.
So you have these body counts that are on par with a normal flu season. Almost all of them are elderly. Almost all of them already have complications due to heart disease, congestive heart failure, pulmonary conditions, which are the lungs, um, diabetes, hypertension. All these, 100% of the people in the Italy study, which is one of the things that you won't hear quoted, had major comorbidities.
Mm-hmm.
you know and if we follow these lines through and we look at it here in the US or just any other place that we have some fairly decent data, the numbers play out. Now they'll toss out there, oh yeah, we had a 20-year-old with no comorbidities just died. Okay, great, that's an anecdote. Okay, I'm sorry that kid died. It happens. So everybody in the world has to lock themselves up. The entire world economy has to collapse, and people start dying of starvation and exposure due to homelessness. People that are stuck with spouses that are abusive are going to die there. Kids are going to get the crap beat out of them. This is the reality of the situation, man. And even if you're not going to take the morality angle, you could still take the utility angle, and more people are dying from this lockdown and will die from this lockdown that will ever, by magnitudes, die from this disease.
Yeah, I mean, a lot of people with crippling illness that would normally be treatable are blocked from hospitals that are running empty from COVID.
Yeah.
And like, also, you know, you want to talk comorbidity. The highest levels of comorbidity occur in the elderly. And,
Yes, without a
and
doubt.
and this is that part of that constant cycle that people bring up where weak men create bad times, because there are a whole lot of medical advances that have come in the past like 100 years, and I'm not
Hmm.
knocking necessarily all of those, even though many of them came as a result of unethical and illegal human experimentation, where the US government murdered a whole lot of people by biological contaminants, but you're not supposed to bring that up because it can't happen here, and you're a terrible conspiracy theorist. But all that
The
aside,
Yeah, the Tuskegee experiments. I'm aware of them.
yeah, and
And
also
like,
Operation Sea Spray, where they sprayed bacteria into the fog over San Francisco, or
hmm
this thing where they smashed bulbs full of contaminants on New York City subways.
yep,
You know,
I'm familiar with them all. Yeah.
tons of things like that. So, like, even though all that happened, we do have a very strong medical system, and more
hmm
people are living to be older. But what that
Yeah.
means is that these people who are like overwhelmingly living to be older, we consider that normal now, even though it's fucking new. It's
Yeah,
not.
it is.
It's not normal. It's fucking new. It's brand new. It's so new and novel that it's not a blip on human recorded history, much less the history of the world, much less the history of the universe. It is a grain of sand on the beach, and
Yeah.
everybody's acting like it's the rock that formed the earth. So, because of that absolute retardation, the entire modus of recording this has been put through a falsely humanitarian lens, because these people who were already vulnerable and at risk are now being treated as though they're the normal group of people who would always be, perfectly healthy otherwise. Um,
Well, we
and
have to see the interaction here too. Remember, the boomers have been controlling our culture and media for decades now, and they are now the elderly. So for them, this is a clarion call. This is a warning sign, and they're terrified. They've
yeah.
always looked out for themselves. They're the me generation, and so when something like this comes about, they're going to push their agenda. Everybody has their own agenda, but some agendas are immoral and non-consensual in manner, and that's what we're dealing with here.
Hmm.
There's a lot of interplay going on, Jeremy, and uh, you know, it's hard to tease a lot of the stuff out, and it's hard to say, well, this is the definitive thing that's going on. There's a lot of different exchanges and interplays going on here. And so when you try to explain this very complex system to somebody, you got to ease into it. And that's the reality of it. And for me, coming from the science and medical background, I just focus on, what's the outcome of this disease. And the reality is that 98% or 98% or something ridiculous like that are
99
going to be
plus.
fine. Yeah,
Because,
99 plus whatever are going to
well,
be just fine.
and if I'm not mistaken, because you can obviously correct me, I brought on an expert. It's basically your show right now. What I'm going to say though is that the sheer volume of asymptomatic carriers would absolutely plummet the fatality rate if every single one of them got tested. And the fact that they don't express symptoms means that most of them, by the vast fucking majority, aren't getting tested. And it's already something like 4% fatality rate. It would probably be like 0.4% if they actually all got tested.
Yeah, well, that 4%, that might even be an outdated number at this point. Of actual recorded, it's going to be 2% or less for the most part outside of hotspots like New York City. But even within New York City, 20% of all people tested have shown positive for antibodies. Well, that means that their numbers, when they talk about, well, 10% or 5% or 13% or whatever died, has to be marginalized now. If you're looking at 3 million people and you have 13,000 deaths, that is a statistical blip at best. And that's in one of the worst case scenarios.
Yeah.
Places like California have, 1,800 deaths. Okay, that's a lot of people. It sucks. Okay. But when we look at that compared to the newest Santa Clara study as well as the USC study, their death rate is like on a 0.002 scale or something crazy like that. Nothing that's going on justifies the actions of the state, of any extra state entities, and what the paradigm of what the general population is advocating for currently.
Right. Well, and like, why don't we compare it to heart disease? Why don't we compare it to cancer? Why don't we compare it to the normal, absolutely massive killers and see what other freedoms we're willing to revoke over this? Obesity is huge, but, fucking pun intended. But fucking, we've got just an absolute magnitude of people saying that this thing is so much worse because of that, because this thing is highlighted because of spotlight fallacy, and because if you say to somebody who did lose somebody that
Mm-hmm.
the issue shouldn't be controlled by the state, you're denying them what is presented as the only solution, and you're a heartless, cruel monster.
I
So
have literally been called a murderer numerous times in the past month.
yeah, well, and like, to be completely specific, um, I'm heartless, insane, a murderer, a bully. I lead a hate group and a cult, and a long list of other things. Like, everything has been coming out in the past several months, and largely to do with this because the mentality I'm having is to try and measure it against other numbers, to try and be rational, to try to be reasonable. It doesn't strike me as remotely reasonable to say we need to lock down society, resulting in poverty, which is a massive killer, and resulting in the spiking of a bunch of other now untreatable diseases, with an overburdened medical system that should have just told these people to go home and try to write it out.
Yeah. I don't know. And once again, I hate to rely on anecdote, but I'm getting anecdotes in from people I know and healthcare workers of people that are not being allowed to the hospital and actually literally dying. You
Mm.
know,
Yes.
So the counter X's anecdote of, oh, I know somebody that died of COVID-19. And I was like, well, this person died because they weren't allowed to get treatment. They were literally being stopped from getting treatment. You know. But once again, I always want to go back to the numbers because I'm a numbers guy. I'm a scientist. I've been doing this since 1994, either as a student or as a clinician or as an educator. And, I'm not here to flash my flag of whatever. But the reality is most people don't understand how science works. They don't understand epidemiology. We can talk about the second wave, which is coming. And they just don't understand that situation. These states that are opening up are going to get a bump. But guess what? Every single state, as it opens up, is going to get a bump because that's how this works. Until you have a critical mass of individuals that have an antibody titer, which looks like it can happen pretty quick according to the studies that we're looking at now, or you have a workable, usable vaccine, uh, or the whole population dies, which is not going to happen, then these waves come. And just how it occurs. That's just the nature of the epidemiology of infectious disease and known historically within humankind.
Yeah, absolutely. And again, grain of sand in the beach. Like, the vast majority of human history has been replete with examples of people dying of illnesses like this and simply going home and writing it out. And ultimately, a lot of these people just want a statist solution so that they can fucking, like, feel like they stuck their dick in something even if no child is produced. And, it feels real good, but it's not very useful. And so the whole
It's
point,
it's virtue signaling in
yes,
essence.
yeah. And so, like, for instance, um, you know, I'm evil for bringing this up, but we have somebody who has a question, and they're very concerned about this because it's gotten personal for them. They said
Mm-hmm.
their father died last night.
Mm-hmm.
He had pneumonia, 3 blood clots, and a stroke. He was tested twice for COVID-19, and both tests were negative. What the hell
Mm-hmm.
is going on?
And that's a good question. He could just have had another disease. I don't know the history of the the person that passed away. So, in essence, without that history, I can't say anything to that questioner here. Um, blood clots and pneumonia. These are things that we see in other diseases. He could have had multiple different, like I say, the term comorbidities, which are chronic things that are going on in their system.
Mm-hmm.
The reality is a lot of people are actually chronically dehydrated, which is
Mm-hmm.
in the elderly is going to lead to clotting. If they are producing a massive amount of fluid in their body via pneumonia, that shouldn't surprise me at all that they have a drop in hydration in their bloodstream, which would lead to a hemorrhagic or a clotting type of, I should say ischemic, not hemorrhagic. I'm sorry, that's when an aneurysm burst. Hemorrhagic and not hemorrhagic, ischemic type of
Which basically just
clot.
means blockage.
Yeah, an embolism, a clot, a thrombus, whatever the hell you want to call it, whatever terminology. And that is almost always due to narrowing of a blood vessel and or some sort of substance such as thick and coagulated blood. So I really can't answer that.
Without
And
saying it's shard.
yeah, yeah, I can't say a definitive diagnosis with that. I wish I really could, but the armchair diagnosis like that with literally next to no history, I'm not going to say.
But that's the
Uh,
reason I brought it up now, because like a lot of doctors claim they can. A lot of doctors claim that they can armchair diagnose through a Skype call like we're having right now. And that conversation, a lot of these docs claim would have been enough to be able to diagnose. But clearly he was tested twice and didn't
mhm.
come back positive. And additionally to that, he didn't come back positive while he was also having something that could have been treated if it wasn't COVID.
Yes,
So
and
it's another.
he was probably denied treatment because it was not COVID.
Yeah, yeah, another example of the state basically murdering somebody.
Yeah, in all essence. Remember, as I said earlier, the COVID patients, it's that carrot and stick of that money coming in that's keeping these hospitals afloat, and that's the sad reality here.
Aye, yeah, and he says I would bet money they listed his death as COVID-19 anyways.
Yeah, there's no telling. Like I said, coagulation is a common uh, symptomatology or clinical sign that we'll see in there, as well as obviously pneumonia. But he could have. The first thing I would guess, just on that wild that not wild, but just very vague symptomatology and clinical signs, I guess congestive heart failure. But
Yeah, that
that's
wouldn't
just
surprise me. Matt, did your father smoke? That's a good question because a lot of these people in China and in India were smokers. A lot of the people who died were smokers, and specifically old smokers who had been smoking for a long time, and in a country overwhelmed by pollution. Because like I kept on making it very clear because people are fucking stupid and they don't look into this. Not you, Matt. I'm just saying like people in general, but um, people are stupid and they don't look into this. China has fake skies, billboards that have fake sunrises and sunsets that play on them so that people can huddle around this billboard and act as though they don't live in a polluted hellscape. Um, they have suicide nets at the bottom of their factories so that if somebody jumps, they don't die. They have plastic guards in the way of the tools. So that if they, want to end it right there on the factory line, they don't stab themselves in the face with a soldering iron or something similar. And, these people were fundamentally unhealthy in a variety of ways, not the least of which was the pollution, not the least of which was the heightened stress, which cortisol fucks your immune system.
mhm.
The heightened stress from living in a late communist pseudo capitalist technocratic hellhole that is China, and then add to that the fact that a lot of these people who did die were very old smokers, and a lot of these problems start to become very clear. These people, a lot of the ones dying, thought they could, and I'm being very, very careful not to shout right now because I am extremely angry at the fact that people don't get this. A lot of these people who died of COVID were extremely unhealthy. They lived a long fucking life of being unhealthy, and then sorry, you know.
Yeah,
And
yeah.
I want to get this out there. I'm sorry for your loss, Matt. And I hope you can find some peace. And I also, you know, if I'm right about this being a BSL-4 lab created virus, which maybe you can talk about for a bit, uh, I'm sorry that the government helped kill your father. You know, I'm sorry that he was in the way of their agenda, and they didn't care about a few million deaths that Stalin would call the statistic. You know,
Yeah.
it's always heartbreaking.
My
Um,
my condolences as well to the bereaved.
and,
It stinks.
and of course, he says that his father smoked for 27 years, but quit
Well, there
like
you
30
go.
years ago.
Mm. Well, he'll still have sequelae that takes a long time to heal if ever. Scarring and stuff like atherosclerosis is not going away.
Yeah, and neither is the damage to his heart, which is what might have caused the COPD.
Yeah, yeah. There you go. Um, Man, oh man. So you want me to talk about virology now?
Yeah, the BSL-4 level lab. Do you know anything about that?
Oh man, there's a lot of conjecture out there. I haven't. I'm going to be honest with you. I've been dealing with the epidemiology as far as it's going on in the United States because that's going to be my focus of study. In comparison to that, along with other nations and other regions within the U.S. that are not going in total lockdown versus lockdown, because my whole goal has been this whole time to get rid of this lockdown procedure that I find both immoral and of no utility whatsoever. So I've not really focused on patient zero, so to say. Uh, Personally, it's almost, but it isn't irrelevant if somebody ate it in a wet market or if they ate some weird animal just because they were hungry or whatever out in the wild, or if it came out of a lab. I'm getting a lot of contradicting reports that I've read. One just yesterday, a day before, debunked where they had 11 patients out of uh, Hainan province or something like that. I can't remember whichever province.
Hunan.
Hunan. And they had 11 patients with 30 different strains of coronavirus. Oh, it's got to be a bad test. There's no way the evolution and mutation of these things occurs at that breakneck of a pace. If you have that much mutation going on in a virus, you know what happens to the virus? It falls apart.
Mm-hmm.
It
Yeah,
literally falls apart. There's no way because there's certain what's called conserved areas. And this is the problem with some of the testing and why there's crossover between people that have had flu vaccines in the past testing positive versus those that have actually had this strain or this group of strains that have recently come out of coronavirus. And that's because these conserved areas deal with attachment to the certain cells within the body of specific hosts, um, how they go about their replication and making their replicants, offspring, depending on how you want to consider viruses, whether or not you want to consider them alive or not alive, whatever. And the reality is that way too much mutation is going to lead to this. Now, conversely speaking, if this was completely genetically engineered within a lab, which is not outside the realm of possibility, there would be even fewer variants than we're seeing, to be honest. And we're just not seeing that. I'm not, once again, like with the lockdown procedures and the numbers there and the number of asymptomatic or pre-symptomatic and mild cases, there's nothing pointing there that anything like this was a purposeful biological weapon. I do not discount that there is a slight chance that this escaped from a Chinese lab and the Chinese ended up using it as leverage, so to say, in order to enact economic warfare. I really think it's blown up in the Chinese faces right now. They are built upon an export economy. And if you stop their exports, the whole massive, and they have a Keynesian setup that's beyond anything that's ever been seen on the earth. Huge cities that are completely empty, just built in order to increase productivity. That whole system will fall. You're going to see massive famine and civil unrest in that country if they push any further.
yeah. Well, so because the thing is, the guy behind the U.S. Convention on Bioweapons, um, that was authored under Bush Senior, he
Hmm.
claims this seems like a gain of function bioweapon, and he traced it back to a BSL-4 level lab, and Patient Zero, if you want to talk about that, reported by the BBC, Guardian, etc. All these major outlets have said this at one point and then quickly swept this under the rug, because that's what a lot of these people do. They'll tell you the truth and then they'll sweep it under the rug and still run with the prevailing narrative, because that way they can say they told you the truth while completely ignoring its implications. It's very dirty. It's very yellow.
Hmm.
But
Yeah.
basically, anyone who's traced it back has found out that they did not come into contact with that with that wet market. They did not come into contact with the bats. Patient Zero, in fact, was an old man who was sold. He had Alzheimer's, and he like could barely leave his apartment, much less leave his apartment, go a significant distance away to this wet market, and come back with bats. He didn't eat bats. He wasn't contacted by bats, and yet he was patient zero somehow. And they report this and then ignore it. Everybody ignores this fact, and everybody also ignores the fact that the first major credible case study of this virus in China, 2/3 of the fucking people tested were not in contact with bats. So what the fuck? Like, I don't. This whole bats narrative is a real good way to get out your xenophobic, jingoistic kicks and say, ooh,
Sure.
Chinese men bad. But it's not a real
Yeah.
good way to be scientifically or epidemiologically
I,
accurate.
I'll be fair as far as this goes because I don't know much about wet markets. I can tell you my experience, at least with the Vietnamese culture. Uh, their ideas of food are a bit more exotic than Western palates are used to. However, I don't think that's the situation here. A lot of times, and the reason why a lot of these different pandemics and COVID-19 can hardly be put up there with them as far as the numbers go. These pandemics start in China because of one, population density, but two, close proximity to other animals that are alive, and we have a zoonotic factor that jumps the ship. In essence, a mutation that allows a jump from, say, a pig to a human, or a horse to a human, or a chicken or a goose to a human. So it's not without outside the realm of reality. The thing with a lot of the stuff that's going on is that you keep a kernel of truth in there, Jeremy, and you put enough jargon in there in order to sound like it's official and it's something that is reality, when in fact it's pure speculation often, or an outright lie. And that's kind of what we're dealing with right now. I would love historically at some point in the future to deal with the patient zero question and look at that much deeper. But right now, man, we're on the front lines. We're battling for literally the life of the world economy, and we're looking a second wave of the Great Depression right in our face right now. We really can't be bothered with Chinese butchers, so to say.
Right, yeah, and that's the other element of it. Like, I already got so much shit because I attack every statist, the right, the left,
Mm-hmm.
etc.
Mm-hmm. Mm-hmm.
For and you've watched it happen because we've been Facebook friends for a while. You've watched me take shit from all sides.
Yeah,
Um,
sure.
and one of the reasons is I attack the status quo. And when I attack the status quo, a lot of status quo supporters are very quick to dismiss everything I'm saying because, quote, capitalism and the way things are have lifted a bunch of people out of poverty, and that has prevented mass deaths, that's created prosperity, and all this shit. And now they want to turn it off. What? How are you going to push neoliberal capitalism as the solution to this? And then when I'm saying it should be left on because otherwise a lot of people will die, suddenly you don't give a fuck? When did that happen? When did the new normal become the new status quo? And why am I suddenly the bad guy for saying what you said was true is true? Huh?
They live within a matrix of fear. That's it. They literally live within a matrix of fear. They've bought into this paradigm. They're absolutely terrified of dying. That's what it comes down to. Fear is a great controller. But as we can see in the past couple of weeks, there's been some cracks in the system. There are people that are literally on the verge of absolute economic collapse, and they're going out and they're protesting, or they just don't care and are just going about business now. Government relies on people to be compliant because they don't have enough security officials to hold down the whole country. You could use all the military, and that's what, 1% of the nation active military. There's no way you're going to hold everybody down. You're looking at chaos if that sort of thing starts to occur. And so we're dealing with two groups here. And group one is the one we know. This is the major paradigm group, and they're either out to control or they're in absolute abject terror right now. That's everything that I'm observing. On the other side, I'm going to be folks like you or I, and I don't believe in the morality of the state. Let's admit it to ourselves. We're a minor, small fraction of that. But there's a larger and daily growing group of people that are just fed up. They don't have any belief in this lockdown. I know people are just like, tell me somewhere I can go to a black market salon, where I can get a haircut, a place that I can go and eat a steak. I want to go work and not in a quote unquote essential job. I want to go back to my job. I want to open my business again.
We are all essential.
We're all essential to ourselves. That's it. We are all essential to ourselves. And that's what people don't understand. How can you talk from this place of privilege when you're working at home, you're having somebody deliver to you? So their life is not as important as yours. We don't have the Amazon drones dropping off stuff remotely. We don't have these Google trucks or whatever just dropping stuff off remotely with no humans involved. These are real people. So you're saying that your life is more important than theirs in order to feed into your fear, but anybody else that wants to go out is absolutely vile and evil. I mean, what kind of duplicitous thought or rationale is going on there? It just does not make any sense to me.
Well, and again, this shutdown is going to cause poverty. It's going to cause poverty, which is going to cause malnutrition, dehydration, lack of exercise, sedentary lifestyles, low contact, high cortisol levels, and ultimately fucking death. So
that's over the long term, but even over the short term, people are going to be, domestic abuse is way up, child abuse is way up. We're not hearing it, but I guarantee you that suicides are way up right now. And this is just the beginning of it. There's 26 million people in this country filing for unemployment. That's out of a total of, I want to say, I can't remember the last time, somewhere between 65 and 100 million people that count themselves as employed, either self-employed or through another company. So that number of 10 or 12%, that's not even right anymore. It's somewhere between 20 and 30% of the working populace is not working right now. I mean, how can you justify this?
Right. Well, and also, before we get too far into that, Matt, also, I have a question for you. I tried to ask it on Facebook, but I think you didn't see it. But what's your blood type? Let me know in my comments on Facebook. I think he doesn't have a YouTube account because he's commenting on Facebook. But
he was on one of your threads or one of mine?
On mine. Your thread I don't think has gotten any comments yet.
That's fine.
I tag 100 people when I post my videos, so
I'm aware.
there's a significant amount of annoyed people, but fuck it. Like, as far as I'm concerned, I'm putting out an important message, so they can eat that. But if you wouldn't mind telling us your blood type, because the thing is, a lot of people with A, especially A, and secondarily B, blood types have much worse time with this virus. But if you're O, it might explain why, and all other viruses, to be completely straight. But if you're O, you might have lower susceptibility to this. It's one of the reasons that O is the O negative is the universal donor. I'm the universal donor. I could give you blood. Except they won't let me donate because my heart rate is too fast because I have hypermetabolism. But that's a subject for another video.
So
go ahead.
Go ahead. He wants to know my blood type. Yeah.
Okay. So I do want to know your blood type too, but I was asking him what his blood type is.
Roger that. I can tell you that I've heard some stuff about O. having those with O having less of an issue, but I haven't really seen good numbers on that, to be honest. If you or anybody else has some information on that, just send me a Facebook message or tag me in something so I can read up on it. Because once again, I've been focusing on the epidemiology and the numbers of people affected directly, not looking at, like I said, I got burnt early on with treatment, so I'm kind of holding back on that. Um, Although I'll put some stuff out there for speculation. But to let you know, I'm A positive. So I don't have any, I don't have any way of saying that, well, I guess I can be careless because I'm O negative. That's not the case here, you know. I guess based upon the supposition that the individual is asking you, I should be at higher risk. I don't know if A positive haplotypes are, or if B positive or A or B negative haplotypes are at higher risk. To be honest, I have not seen that research, and I don't know. It almost smacks of the blood type diet to me, which I find pseudoscience is best. Once again, I'm willing to change my tune on that if I see new research, or even old research that shows something in the past month or two about this and the correlation or causation here. But I
Okay,
really haven't.
well, I'll just read this. This is from Jay Chao, in China, and a team of researchers in China, that discusses the quote relationship between the ABO blood group and the COVID-19 susceptibility. The abstract reads as follows, and I'll just read that because, well, the first paragraph of the abstract,
Sure,
because I'm
sure,
not going
sure.
to
Yeah,
read a
that's
whole study right now, but
no, the abstract's perfectly fine. Go ahead.
the novel coronavirus disease has been spreading around the world rapidly and declared as a pandemic by WHO. Here we compared the ABO blood group distribution in 2173 patients with COVID-19 confirmed by SARS-CoV-2 tests from 3 hospitals in Wuhan, Shenzhen, China, with that in normal people from the corresponding regions. The results showed that blood group A was associated with a higher risk for acquiring COVID-19 compared with non-A blood groups, whereas blood group O was associated with a lower risk for the infection compared with non-O blood groups. This is the first observation of an association between the ABO blood type and COVID-19. It should be emphasized, however, that this is an early study with limitations. It would be premature at this time, but it should encourage further investigation of the relationship between the ABO blood group and the COVID-19 susceptibility. And that has like a team of researchers on it. We got Xiao Zhao, Yan Yang, Han Ping Wang, Dong Li, just a ton of names associated with
Hmm.
this study. And the
Yeah.
fact that their sample size was 2173 is promising because like it's better than some of these low level tests that I've seen going around, floating around immediately on social media because everybody assumes that because a study was done, it's automatically confirming whatever their point
Yeah.
may be. Like confirmation bias is heavy here. And
Certainly.
I've seen that like people say like 23 people were tested for this thing, and therefore it's fine to say that this is universalist results.
Oh,
But
yeah. No. Sample size biases and drift from there, and sample error. Margins of error
no control
are
groups.
no control groups. A lot of them, remember, are going to be clinical studies, not actual true research studies.
Yeah.
And some of them are going to be polls. Some of them are just going to be, well, we tested this many people,
Hmm.
and that's it. And 2,000 is usually a pretty good number with humans when you only look at human health and just researching humans in general. Usually, the number, at least that I tell my students, is you want to get up to about 20 to 30,000 to really get a good,
Right.
not fuzzy image. The 2,000s are perfectly fine. Now here's the caveat I'm going to throw in there. There is some regionality historically to blood types, blood haplotypes in humans. For example, negative haplotype is almost all Rh negative blood type is almost all people of Northern European origin,
Yep.
or somebody
Ich bin
related
Deutsch.
to, yeah, the Germans, Scandinavians, British, Scots, stuff like that. It's a much more recent mutation. ABO is a bit more ancient, but there is some historical segregation of this. For example, A is mostly going to be in the Western European and Mediterranean basin, whereas B is much more common in East Asian countries. So of that 2173, how many of them were actually A? So if you got over 2,100 of them, and you got like 50 or 150 A's, that's not going to show you as good resolution as the vast majority of them that are B's or O's, if that makes any sense to you.
Right. I think I'm going to send that study to you so that you can further review it. And maybe there's
Mhm.
like distribution errors, but it did seem relatively thorough from what I could see.
It is interesting, and it's not something I would completely discount. Uh, as the studiers say, it is worthy of further investigation. But we also always have to remember, as scientists, that correlation does not equal
Right.
causation, and we'd have to look at the history of these individuals. I can tell you, studying humans is probably one of the most tricky things for a biologist to do.
Yeah, and that's why they studied on animals, which is a terrible analog in some cases.
Yeah, yeah. I mean, some stuff like rats or monkeys is going to be close enough. Like the AIDS research facility at the Center for School of Tropical Medicine at Tulane uses rhesus monkeys because they do have the same blood types as humans.
Well, right. Although, but a lot of a lot of the problems with these studies is the like quantity to biomass. So like they force feed rats pounds of a thing and then say that it's unhealthy for humans to have like a quarter teaspoon. It's toxic dosage is very underconsidered, especially in a lot of these more sensationalist studies that sling around because somebody needed to have their name on a paper to pass med school.
Yeah, yeah, yeah. I get where you're coming from completely. I get where you're coming from completely. Um, yeah, I don't have any good answer there, to be
Yeah.
honest. I don't have any good answer. And I just opened up the thing. I'm going to read it in a little bit, and I'll go ahead and make some commentary when I'm done here today on your thread related to this webcast.
All right, sounds like a plan. So, before we go, uh, is there any advice you would give anybody concerned about this virus about how to deal with their own personal life in order
Sure.
to like sort of avoid it, write it out,
Mhm.
get healthy? What are your prophylactic treatments, and if diagnosed with it, what is your prognosis? Like, if you just had to give general, broad-based conclusions here.
Okay, so a lot of stuff is easily verifiable here, and the precautions that we would take or prophylaxis that we would take with coronavirus is going to be very similar to any upper and lower respiratory infection that's spread through droplets and or aerosol. First of all, a little bit about coronavirus. It is an envelope virus, which means it takes a portion of the host
Mm.
cell outer fatty layer with it as it goes out. In effect, it gives it another layer of protection, and it also camouflages the virus. This is also its weakness, and this is what people are trashing Trump about right now. But I was a little hesitant to go ahead and rip him yesterday, and that is a high energy, high heat system such as UV light or real high temperatures, and this may be why we're seeing lower numbers in the equatorial regions, will break down or denature these envelopes. Okay. Also, if you're washing your hands, you use warmer or even hot water that you can handle. Regular soap, like Dawn dish soap, regular dish soap breaks down these fats as well.
And the
Now you
protein
can,
structures.
yeah, well, the fats are what's more important because the fats are all the way on the outside. The
Yeah.
proteins are in, and then all the way on the inside is the genetic RNA or DNA genome on the inside. So it's really the fats that we're worried about here. Stopping the fats from being sticky and breaking up the fats when we can. If it loses this envelope, this coronavirus is trashed. It's done. Okay. So simple hand washing. Wash your hands more than you ever thought you ever washed your hands in your life. Most people may wash their hands when they take a bath at the end of the day. I like to joke when this all started. People are getting all of my junk and trying to educate me on prophylactic measures, and I'm like, I wash my hands more in a week than most of y'all wash in your entire year. Wash your hands. Don't touch anything that you don't have to out in public. Now, there's different studies saying different things. I can tell you coronavirus is going to have a relative stability of at least a few hours on surfaces. Wipe down stuff. If you work in an office still, wipe down stuff. It's really not difficult.
As long
It's
as
the
you
same.
don't plan to eat that.
Yeah, sure. Uh, if it's almost all the same precautions that we do for influenza. Cough into your elbow. Don't cough into your hands. Or if you got your hands, and cough into a napkin and throw away the napkin or handkerchief. You know, um, if you are at a high risk group, I would strongly suggest doing some of the other more intensive prophylactic things, or if you're in direct contact with them, and that would include a mask of some type. It doesn't necessarily have to be N95, but those at risk should definitely consider it. Something as simple as a bandana. Say, like when I went to go work on my grandparents' plumbing recently, I put on a bandana over my nose and mouth, and I felt perfectly comfortable with that. Um, uh, you know, don't go into large crowds if you're that concerned. Uh, Go to a healthcare facility only if you need to, really, for an emergent problem. Because remember, sick people congregate towards healthcare facilities. Don't go in at high volume times into say a grocery or whatever, or if you have to have that stuff delivered to you. These things are very, I hate to use the term common sense, but that's the one I'll go with. That's a common lexicon. These things are kind of common sense. Just avoid trying to get droplets that'll hold viruses on you. That's it. That's really it, man.
Right. Well, and so like, funny story. I used to work at a Jack in the Box
Hmm.
many years ago.
Yeah.
And it was my first official quote job. Um, but I absolutely fucking hated it. And one of the reasons I hated it is because they were lying, hypocritical cunts who broke the law regularly.
Oh
And
yeah.
so one of the ways they broke the law was there are certain guidelines by which you're supposed to live in order to in order to meet food service
Standards.
specifications, in order
Yeah.
to keep your license, in order to stay A rated. And I would follow those, and I was the bad guy. Because I would follow those somewhat rigidly. And one of the ways I was the bad guy was they would go to turn on the water to wash their hands, and it would be at the right temperature, the legal temperature. And they would
Hmm.
claim it was too hot and that it burned them. And I had just gotten done washing my hands, and I was fine because I'm not a fucking bitch. So, like, maybe don't be a fucking bitch. Wash your hands properly, like to the standards of somebody who works at Jack in the Box. If you can wash your hands as well as Jack in the Box employees are supposed to, you'll be fine. And then, like, know two things. First off, it's not just washing and sanitizing. Jack in the Box employees know this. You wash with soap, that kills most of them, and then you sanitize after they're fully dry, and then you dry that. You swing your hands around in the air until they're air dried.
Hmm.
Um, and if you do all of these things properly to the level where my stupid bitch ass coworkers would have problems with it, then you'll be probably okay.
Yes, I would agree with that assessment. As long as you're not at risk, and even if you are at risk and you fall on some very simple personal hygiene, sanitation standards, along with some really minimal things like maybe a mask, if you are at risk, then the chances of you getting this are very minimal. And for those that do, the chance that you have major complications, unless you're already ill, are also very minimal. There's nothing to be scared of, folks. If you want to make people around you more comfortable, I say by all means wear a mask or gloves, whatever it takes. Um, but I, in no means, way, or form, as I said in the opening today, do I support mandatory lockdowns in the general populace. Mandatory mask wearing, or any of this foolishness, because it's not based in science. It's based upon this matrix of control. That's it.
Yep. Yeah, some politicians lining his pockets. Some corporation got a kickback. They were the first bailed out. I still ain't seen any cash. What the fuck? Where's my Trump bucks, bitch? Um, so, like all this stuff, it's a power transference thing where the small guy is kicked out because you can't operate a major business on a small level without these major corporate bailouts, and because a lot of this small business stuff got dried up real quick.
Hmm.
um, you know, so the money is transferring to corporations and therefore the social control power, and those
Sure.
corporations are helping boost the politicians who are making a huge amount of money for themselves and for their lobbying and for their future campaigns. I mean, for years, I was saying that there was going to be an event that would make 9/11 look like child's play, and that it would help Trump rally support around his new 2020 campaign because of his handling of it and because he got everything under control quickly. I didn't know what it was. I just knew that the voices in my head were telling me that. So I repeated
I
it to the
think they called
public.
it right. You called it right. Whatever voice in your head, that intuition or whatever, called it right.
Yeah, so I mean, on Moment of Rage, on Hellscape, I talked about this. People called me crazy. Here we are in the future, and I wasn't so crazy. However, just to really hammer this home, y'all are giving all these people the power to fuck you in the future. And if you support this tyranny, not only go fuck yourself, but if you ever complain about tyranny again in the future, I will bring this up and I will hold it against you. And I think so many other liberty lovers will too.
Yeah, yeah. This won't be easily forgotten.
Yeah. So, anything else you want to say to people?
No, not at all. I have full confidence on people on an individual basis. Get yourself informed. Don't be stuck in a loop of fear. For those of y'all that have had the chance or the privilege or whatever to go over this and see that this is the reality that I'm stating here, y'all. I don't have any other. I don't have any other agenda other than giving everybody as much personal freedom as possible through education and through knowledge, and pass that information on to people. You're going to be marginalized, and that's just the reality of it. It's going to be okay, folks. Just don't fold or buckle under, and accept that this is how things have to be. And that's the end of it. Thank you so much for having me today, Jeremy. It's really been a pleasure.
Yeah, and thank you for coming on. I think it was pretty enlightening and elucidating for a lot of these things that have been making people upset. Reminder to y'all, if you like what you heard here, consider supporting on Patreon, PayPal, anything. I have crypto options. There's a lot of bullshit. So feel free to do that. Also, feel free to enlist the services of libertyprofessionals.com if you need any sort of private investigation or anything like that. They will help you out, and he does private security consulting. So if you like want to get your business secured, if you want to get your home secured, if you want to have like cameras set up and know how to use them, just talk to him. He's a good guy. He'll help you out. He's got a firm of people who can help you as well. It's a great business. Feel free. But with all that being said, don't believe the hype. Stop helping the Karens enslave your neighbors and fucking smash the state.
Bam.